welcome to this episode in the Massage Warehouse Muscle Whisper series. In this one, I'm going to be talking about how to assess the lower limb. Now, I'm not trying to be a physio or an osteopath or a rehabber in that sense. My job as a soft tissue therapist is to palpate and be able to feel and mobilize and check out what's going on. And in this one, I just show you some really foundational techniques in order to get a clearer picture about what you could possibly be working with. Enjoy, and if you like it, please indicate it at the bottom. Thanks. Bye. One of the first things I do when I'm assessing lower limb is to kind of just run my hands up and compare the shape of each leg to each other. I'm getting a feeling that there is, for instance, on her right, I'm getting a feeling that that front end is actually quite flat and solid, whereas this side on the left, I feel that there is much more engagement happening here. Like there's definitely a different shape from one side to the other. I'm not making a conclusion at this point because it doesn't serve a purpose. I'm just again trying to draw that picture about what I feel through touch and through palpatory type techniques in movement. So for instance, I love this rocking stuff because it kind of tells me how that body moves in more of a spiral motion rather than just doing flexion extension. And I can tell she's got quite a bit of stiffness when it comes to this movement. She does not like to dorsiflex. Plantarflex, that's where she rests, but dorsiflex is not a happy place for her. So, you can get a sense that this is really, really taut. But is that coming from the flatness of her foot? She does have a bit of an arch. It's very tight underneath her foot at this point. But, it's also, what do I feel in the actual toes? Now I'm feeling in this first one here, I'm feeling a good callus. I'm also noting that it's going off to one side. I know I've said this in another case history, but in all case history, it's important to landmark and to look at things in comparison and kind of get a sense of what's normal for her and what is something that she has done to adapt in order to compensate. So she's got some compensations going here, which doesn't help her. She tells me about this leg here having, I recently been injured to the point that she couldn't walk on it. There was just too much pain and tension. And you can definitely feel it. So she would do well to have some kind of space given back to that, and some movement, a recreation of movement here in the mid-thigh. When you look at her right in comparison, when I feel it, I feel like there's a real lockdown on this one, that there's quite a protection going on. So the line of this one was more fluid. I could get this kind of movement happening, whereas this one is more, the whole thing is moving like that, as one unit. So it's not kind of had that spiral effect. So when we were talking and we had her on her in prone, I was mentioning that I felt that one hip was more raised. I felt that there was a pelvic rotation going on. This is kind of helping me to draw the picture and confirm that this is true. Yes? So I didn't make a conclusion on the other in the other position. All I'm doing is drawing the picture, putting the pieces together, see how they fit and see how they feel. And definitely I want to create more movement here. And for her, it's coming up in this area here that I need to recreate some space and allow her to immediately rotate. And that will take the strain off the hip. I would probably go in and do some rotational work. So in other words, if I was to take Rachel, I would want to go into her hip and do some movements. And I have demonstrated this in a number of other videos. I find this kind of mobility, movement-based therapy to be very good because the client's body kind of goes, oh yeah, I like that stuff. I really actually do want to move there. Or I don't have a very good memory of it, so maybe I can reinstill it. Or if they have a lot of pain in it, then maybe I can do other things to ease it up and then gradually get it back to where it should be. So I will work differently depending on the symptoms and the cause, but definitely what I want to see is I want to see more fluid rotational movement. Yes, flexion, extension, and a better balance between top and bottom. So the torso and the relationship through the pelvis, in through the lower limb. I want to see that working well together. And once we get that going, she's going to have a lot less issues with her back. So feel what you're doing, work through it. Do not feel that you have to make a great deal of change in the first instance. I am actually doing some work right now as I'm working through the palpatory state. I'm just kind of feeding back to her body that, yes, we've got this space. Yes, we've got this kind of movement. Yeah, let's release this. I'm just helping the body to recognize where it needs to go, and then her body will do the rest. So this is why for her, things like movement such as yoga and osteopathy do so well for her, because really what they're both doing is trying to give her body some space in which to move. You as a therapist can be offering that extra stuff that she needs to be doing, which is regards to changing the environment of the soft tissue. These are things that yoga and osteopathy don't do as full. If they don't, a lot of therapists don't have time for it, but this is what we do. So we can work in conjunction with an osteopath and with a yoga or Pilates. So I often believe that working with other modalities is essential in full recovery of your client. So we should not assume that that one modality is going to solve the whole problem, because the body is a lot more complex than that. So, top tips, trust your palpatory skills, get yourself a diagram in your head of how the body is moving and feeling, where the tensions are. See if this is, how would you want it to move? You want a little bit more quality in the movement here all the way up the body. So I've already done just a little bit here, and I'm already getting a much more rhythmical pattern between the two sides that is more equal. So I won't necessarily do the same on that side from what I did on this side. So where's my restrictions? How can I make this side move as similar to this one? And that's kind of what I'm trying to achieve, is creating that whole global balance between top and toe. You can use your various techniques like your STRs, your METs, do your reflexive work, do your general. I love compression and vibration and pummeling and, kind of sinking, melting work. This is how I work. Doesn't mean that it is the full answer. You all have your training, you all have your skills in the way that you work, so use them, play around with them, and see how you can approach it from a whole global approach rather than just isolating to that one leg that was injured. Okay, have a go and look at some of the other case studies, and see you in the next vid. Thank you for joining me. Now, if you have any comments, please do leave them below. I might not get the right away, but certainly we'll get to them as soon as possible. If you liked it, please do indicate that you did. And if you want to share it, I welcome you to do so. Otherwise, I hope to see you in other vids. And until then, ciao.